Cardinal, thank you so much for allowing us to talk to you about your spinal problem and the treatment and what happened to you over the last few years.
Yeah, it's a pleasure.
Thank
Yeah.
you.
Good.
I wanted to start by asking you, how did your spinal injury occur, or your spinal problem?
I think I've been driving for too long on rough roads, according to my thinking. I think that was the main cause. I've been driving from places like Tunduru in the south on very, very rough roads before this time. The whole way coming to Dar es Salaam and back and driving all by myself.
Really?
So it was tough, and I think it's where the problem started. But of course, being young, I didn't feel it too much until I came to this atmosphere of Dar es Salaam, where the roads are much better. And then I started feeling what a difference between the trip to distant places and whatever. But suddenly I started feeling the pain in the back. And I remember the very last time when I started feeling I have to visit a doctor and try to find the explanation of it, is when I was in Rome for the election of Pope Benedict. Then I was going, but then I felt the legs kind of remaining behind me. We were in the procession, and the pain was much in the lower part of the legs. And then I was walking, and that passed. But the following month, I was in Kinshasa. Really, I couldn't go together with the other bishops walking. So I simply asked, please, can I go ahead of you and sit there? And they said, of course. And from then, that moment, I thought I had to see the doctor. In the meantime, there was the Mother General of the Immaculate Heart Sisters working in Tunduru, the diocese. I was a bishop there before. She was watching at me walking in Rome for that procession which I spoke about. And she really said, you feel miserable. You're walking and everything is reflected. And then after the meeting, before I came back to Dar es Salaam, she came to the Salvatorians where I do stay in Via della Conciliazione. And she said, no, I think you have to go to the hospital. And I said, but did you suggest any hospital? She said, fortunately, we have a big hospital in Berlin, run by our congregation. So that's where I went first. And of course, I didn't know exactly what was wrong. So they first thought it was a matter of hip. But the hip, they checked, no, they said, no, it's very normal. Yeah. And then they looked at the spinal cord and they said, we have found a problem. So that was the first operation I got on the back. In fact, it didn't last too long, and it went very well.
Let me ask you, why did you go at the time? Did you see a doctor in Dar es Salaam first, or did you go straight to Berlin?
Actually, I went very first to Berlin, because the sister, the one who watched me in the television, said, we have a hospital which can help you. So that's why I went direct to Berlin. But then after coming back, then I had to see the various doctors here in the place.
So, and then after your first surgery, did you feel better?
I felt better for around maybe 9 months. And then the pain started all over again. And I cannot really say why it started again, but I think again I was on those rough roads. Again I had to go, and really I must have not followed the conditions I was given. It must be a real mistake on my part, but I wasn't driving myself, but people were driving me. So they didn't know the pain I have. So they wanted, they thought I was just as normal as the other people. So that's when it starts again. And then I was following treatment in the hospital here. How do you call it?
Moy?
No.
Aga Khan?
No, the other one. TMJ. I was following with Dr. Capitani.
Yes.
Yeah, he was taking care of my heart, etc. So again, I started feeling this same pain when I was going there. And then he had contact with some doctors in India. And then I went to India, and they said, "Now, I'm sorry, you need another operation, because instead of the first two vertebrae that had started with problem, now I had 5. So said, if you continue that way, you will not be able to walk." So I went to India, to Bangalore,
Yes.
and I was treated there.
Why did you not have a doctor in Dar es Salaam?
Well,
Who could do this surgery for you?
people were not recommending me for a doctor in Dar es Salaam, because they said it's too risky.
Yes.
So people were saying that, you said, look at that gentleman, or look at that lady. She went to a doctor here. He was operated on, and then things got worse. They said, for you, our bishop, we don't want you to go into the same process. So I tried to go to India, because they have better treatment and better machines, etc. That's why I went there.
And then you, after that operation, you came back to Dar es Salaam?
I came back to Dar es Salaam. There was a bit of a difficult experience. When I came back, after the operation, I felt quite all right. And then came back, then all of a sudden there was back again that some kind of pain. They said, I went to Dr. Capitani here, and he said, no, this is not the failure of the operation, but you have got infection, which fortunately you had this weak point, he said, in the back. Otherwise, the infection would have go direct to the heart, and that would have finished you up. So I started taking antibiotics here, and went back to Bangalore.
Yes.
And they treated me. And it looked like I began to get cured. But then I had to wait about a few weeks. That they said, go and rest someplace here in India, and we'll call you back and see. But when I went there, suddenly, again I got that terrible pain. And when I went back to the hospital, the doctor said, no, I don't see the reason why you do that. In fact, later he told me that I had started that to imagining the pain rather than being real. So I said, well, I have not succeeded to be such a dreamer to that extent. So the pain was real pain. And then said that the only thing we can do is to reopen the operation, and did it. And suddenly I got so sick that he began to be afraid I was going to die in the hospital. But that went for 3 days. The 4th day, suddenly I was up, not much pain, and I was conscious. And the doctor himself was amazed. Said, I don't know which medicine I gave you. I cannot tell you which medicine cured you. But then he said, well, probably there are so many people praying for you, that's why it's kind of miracle which has happened. I said, okay, I know that plenty of people are praying for me, so if that explains, all right, fine. And so I came back. I came back to Tanzania, and then again, the pain came back. Anyway, to put things short, until we met here.
How did you find out about Weill Cornell? Who sent you to us?
I came here because after seeing that things were not going on too well in TMJ, the government, from the side of the government, actually the president himself said, no, you have to move into Muhimbili, here in the, how do you call it? Moi. Yeah. And so I was here. I was in a very poor state with the heart. And so they were taking care of me here. And then you happened to pass here.
Yes.
And then you looked at me. You saw me how I was in so much pain walking. And then you said, if you could come to the States, I think we could help you. I'm not 100% sure, but I can assure you that we will try our best. Yeah. And that's how I came in touch with New York, with you, and the hospital.
Yeah. How long ago was your surgery now? The last surgery that we did?
It's 1 year and 6 months, I think. When the surgery was, I remember it was on the 8th of May, and then the previous year. Yeah. And so by 8th May this year was 1 year. Yeah. And so, but I'm feeling great.
How long was your recovery after the surgery?
That I don't know, because I was so much unconscious that I didn't know how to count the days before. Maybe if the sister was with me there in the States, she can tell me exactly how long it took. But you probably also know how long.
Yeah, of course.
It took long.
Yeah. But you look terrific now. And how do you feel now?
I feel great. Really, I feel there's no pain actually, except I feel a bit numb and stiff a bit particularly when it's cloudy and about to rain. That's when I feel the problem. But otherwise, I'm all right.
I wanted to ask you, why do you think that there are these problems in Tanzania now with physicians not being trained adequately? So you had to go abroad.
Yes.
What is the problem, do you think?
Well, I think, of course, I'm a layperson in those matters, so But I think the problem is double. First, the instruments here for treatment they are not as good as overseas, and because of that, there's the second reason that the person themselves are not properly trained. They would need a better situation for learning.
What do you think can we do in other countries that maybe are more advanced when it comes to healthcare?
Yeah.
What can we do to help Tanzania and East Africa and the doctors and the nurses here to become better and to be able to treat patients such as yourself?
Yeah, I think one thing they have to get in touch with the doctors from the developed countries and to learn and to have the learning in situations which are much better than this. But also, we need the tools for work, which I think they need to be more sophisticated than what we actually have at the moment. That's my suggestion. Yeah.
No, I think you're right. There's a problem with the infrastructure and the tools and the technology.
Yeah.
And then there's a problem with training.
The training.
And the education and of surgeons and healthcare providers and nurses.
Yeah, in that line, I remember very well. When I was in New York, I was being treated. I thought, really, even the nurses, they were so concerned and so particular in so many small details that I was wondering, why is it different home? There's some you see a patient may be there crying and looking for help, but somebody passes, like by accident, takes care of the patient, and then it goes on and doesn't even go into details. Why are you crying? What is the matter? Etc. of that. But in New York, you didn't need even to cry. before you cry, there was a person say, "What's the matter? What do you think?" And the person took every care to and you feel very much cared for, and much better than here. But of course, I can realize that here, even the personnel we have here, there's so few. One doctor may have to take care of I don't know how many. It's different from a nurse who's taking care of one person or two persons at a time, and the one has to rush from this patient to that other patient, etc. No matter how good-willed that person may be, but he doesn't have enough time to deal with the individual.
It is, just to elaborate on that,
Yeah.
there is we know in Tanzania there are 8 neurosurgeons for 50 million people, and that is obviously a very, very small number for
That's
a
it.
huge number of patients.
Yeah.
And I think that will, for the patient, that means that they cannot be really taken care of.
That's
And
it.
that's why our program is geared towards, helping Tanzania teach and train and educate neurosurgeons, but also nurses and other health providers
Yeah.
to take on this huge burden of disease that comes with neurosurgical problems, back problems, but also brain problems.
Yeah.
The final question, and then I want to let you go. What is your hope for the future of healthcare in Tanzania?
I think with the present government, I have every reason to hope for the better, in the sense that we still have many problems, but the concern of the government at the moment for the poor is the one which gives me hope that the situation will improve. It is easy for one, a rich person or a person in better position like myself. I could come to New York. Why would the government say that there's need for me to go there? And how many people can come from Tanzania and come to New York for treatment? But it's because they said some kind of treatment is for the elite, for those in high positions. So the others, as if they simply have to die. There's no way out. But it shouldn't be the case. So, but the government now, I think, is very much concerned with the people, the low people, low class, and I think for that reason, it's bound to improve even the medical situation in the country.
Is the church involved in medical education here as well, and teaching?
Yes, we have, for example, the Catholic Church, we do have the referral hospital in Bugando, yes, in Mwanza, but also in every diocese, there's at least some health center or a hospital run by the diocese or by the church, which is usually in the past, it has always been a better place, yeah, to rise to than, as I said, the government, because of this lack of too much attention for the poor. Yeah. But now I think I have to repeat again that the government is showing a lot of improvement. Yeah.
Well, thank you, Cardinal. I'm very happy that you're doing well, and I'm sure you will continue to do well and hopefully even better.
Thank you.
And
Thank you. Thank
you'll be
you.
able to help all of us improve the treatment, medical treatment and care in Tanzania. Thank you so much.
Thank you very much. Thanks.
Thanks.
Once again, thank you for the treatment I received. Thank you.
It's my honor.